looking at general management, general nursing management in psychiatric conditions, general nursing management in psychiatric conditions. So you must know the general nursing management in mental health conditions actually. So you need to understand what is involved and what you must do, and also the most important headings that must appear in your, or rather as you nurse the patient with a mental health disorder. Now the first thing that you must do is to come up with the aims. So what could be the aims? So I would advise you that you admit the patient. Okay, so your aim is to admit the patient. Okay, your other aim is to relieve the signs and symptoms. Your other aim is to prevent injuries to oneself and the others. The other aim is to create, or rather, make the relationship between you and the patient. The other aim is to, rehabilitate the patient, and so many other aims actually. Okay, so now the heading number one, or rather the second heading after the aims, is the admission. Okay, so the patient who comes to the psychiatric wing with a mental disorder must be admitted, so that they are observed, so that they are treated, or rather they promote certain functional skills that the patient must follow. Now, on admission, we know how to admit the patient actually. Okay, you need to collect the patient's particulars. That includes the names, age, sex, the diagnosis, and so on and so forth, and be written in the admission book, and other things follows next. Okay. Now, the other heading actually is safe environment. So the environment actually must be safe. Okay. The room must be clean and lit. Then well ventilated, and patient should be isolated if at all the patient is considered to be very dangerous to others. So the patient might be isolated and must be might be in an isolation room alone. Okay. Now, in that room where you're going to admit the patient, or rather the environment, must be free from ropes, must be free from certain equipment that the patient might use to injure themselves, must be free from stones. Okay. The room must not contain anything that might harm the patient. Okay. So the environment actually must be free from noise. Okay. Now the next heading is nurse-patient relationship. As soon as the patient comes to the hospital, okay, we know to say this patient has got a mental disorder. Therefore, you have to know that people with mental health disorders, they are disoriented, okay, they are dangerous, and they portray certain characteristics that might result into harm to you as a nurse. Therefore, creating the relationship with the patient is very important. People might, these patients, sometimes they become so paranoid, especially in cases of schizophrenia. Okay, cases of schizophrenia, depressive disorders, and other conditions that falls under mental health disorders. They become so dangerous. Okay, I'm sure you've heard of paranoid schizophrenia, or rather paranoid schizophrenia. These people, they are scared, they fear, they are aggressive. So it is important that you have that relationship with that client. Okay, so when you make the relationship with them, they will be free with you, and they only discuss things with you. So once they become so comfortable with you as a nurse, meaning that at the end of the day, you are going to achieve the goal that you have put in place. Then the other heading actually is prevention of injury to oneself and others. So in this case, just as I talked about it when I was talking about the environment, some people, or other patients, they are aggressive. Okay, so you have to know the patient that you are admitting, or rather the patient that you have on the ward, and make sure that you prevent injuries to themselves and others. Okay, so you consider others also. You do not have to mix the patients in the one ward, or rather one room. Okay, because these patients who are aggressive might actually injure others. Okay, they can get anything, especially stones, and start stoning others. Not only others, even yourself, you as a nurse who's nursing the same patient. So you make sure that you do all things possible to prevent injuries to themselves and also others. Okay, remember, I'm just hitting the point. I'm not going to talk about everything because of the length of the video. Then patient orientation, or rather communication, very important. Okay, patient orientation, or rather communication, very, very important. This one is self-explanatory. Okay, this one is self-explanatory. Then family therapy. Okay, it is important that you engage the patient with the family. Okay, family members should be able to be, should be educated actually on the patient's condition so that to accept, they accept that person. Okay, because without the education to the family might not accept the person who has, that condition. Therefore, they might start neglecting the patient. They might start thinking of other options over the patient. Therefore, even the patient now, because of rejections, the patient might be feeling so lonely and they become stigmatized. They become so depressed. They feel so rejected, and so on and so forth. So the family members should be engaged so that the patients, they are not that neglected. Okay. Now, always involve the family in planning of patient care, and always make sure that the family has that relationship with their relative. Okay, and so on and so forth. Okay. Then the other heading actually is psychotherapy. Okay, psychotherapy. Now, what is psychotherapy, and what do you not need to talk about? Okay, what do you need to talk about under psychotherapy? Now, in this case, you need to make sure that you explain the condition to the patient. There are patients that might be able to listen and they might understand certain things. But remember, this is a general thing here we're talking about. So we do not know the patient that we're dealing with. But always make sure that when you are dealing with a particular condition, talk specifically about that condition. But generally, in here, we are going to say, under psychotherapy, you explain the condition to the patient and also the family. Okay? So as you explain, the condition to the patient, make sure that the patient understands clearly on what is happening around them. Okay? Psychologically, they have to be, sometimes they might not know also what is happening around them, but they need to understand what might happen to them. Okay, so you need to explain to them and make sure that you reassure them that they will be fine. Okay. Now, in this case, you need to make sure that patients are not depressed. Patients are not so isolated. Patients, they are not in that state of anxious, or rather, having that anxiety. Now, another heading is group therapy. So here, you need to make sure that you engage, or rather involve others in the management of certain conditions, because when you group them, especially when they're having the same condition, it helps them. Okay, it helps them. So now you need to help them to make sure that they develop certain communication skills. Okay, they have to develop certain communication skills with others. They have to associate, and socialization skills is very important to them, especially with similar conditions. Okay, allow them to make sure that they learn from others. They have to accept criticism, and they also allow individuals to develop self-awareness by listening to others with similar issues actually. Okay, then the other one is actually individual therapy. Okay, so this is a process through which clients work one-on-one with a trained therapist. Okay, in a safe environment, the environment which is conducive for caring and confidential. Then you need to make sure that as they interact with the therapist, they are keeping confidential things that the patient might explain to them, or rather to you as a nurse. Okay, now this therapy actually helps patients to overcome obstacles to their well-being actually, so it can increase positive feelings such as compassion and then also self-esteem. Now the other one is occupational therapy. Certain conditions under mental health disorders, people might lose their jobs. Now as they lose their jobs, make sure that you help patients to gain, or rather to regain certain skills. Okay, they have to gain certain skills. Now these skills might help them to make sure that they are not that depressed when they lose jobs. Okay, so occupational therapy will help the patients to make sure that they have various skills that will help them stay positive in life. It will help them to make sure that they are well connected with the environment. Okay, so now this treatment actually helps on helping these individuals to have their physical skills. They need to have positive thinking, they need to be trained in various skills because they may not continue with their current employment. Okay. So now in this case, you need to help the patients of all ages to improve in their ability to perform tasks in their days, living and also working environments. Okay. So now, occupation action includes all activities or other tasks that a person performs each day, such as getting dressed, playing a sport, cooking a meal, getting together with friends, working at a job, and so on and so forth. Okay. Now, you also, the other heading actually is recreational, recreational therapy. So this is a systematic process that utilizes, recreation and other activities based on, interventions to address the assessed needs of individuals with illnesses or other, disabling condition as a means to psychological and physical health recovery and well-being. So now, you need to use variety of modalities that includes the arts, crafts, drama, music, dance, sports, the games, as well as community outings to just help these patients, to maintain or rather improve on their physical, social, emotional, and other things like mental well-being. Okay. Now, in this case, you also need to talk about improving nutritional status of that patient. Okay, you need to improve the nutritional status. Then talk about observation. You need to observe the patient. Then also talk about other things like supportive therapy. You need to talk about peer therapy. Talk about hygiene. Talk about sleep and rest. Talk about psychopharmacological therapy, and also other things that we have not talked about here. Okay, so actually at this point in time, I think you know what to talk about under general management of patients with mental health disorders. Thank you so much for listening to this wonderful video, and you can share to others. If you care about others, please you can share and make sure that you teach them where they do not understand, or rather you can refer them to me. I can teach them a little that I know. If you do not understand, you can still ask questions and we'll be able to answer you. Thank you so much.